It tells you like all of the kind of benefits that are available to veterans through, VHA.
It's very funny. I work out in a gym and they have like 100 different TVs and they all different channels, and they were talking about the VA, and they were saying it's like too expensive. I thought that was kind of an interesting coincidence.
Who was saying that?
Fox News.
Saying that the VA is too expensive?
Uh-huh.
I
Or
mean,
that it was like an example of entitlement. And so it kind of like fit in with like the whole like Medicare for all debate.
well, I'll tell you, we've worked you and I have worked in a place where, there are certain benefits available to people based on their medical or mental health conditions.
Right.
And in the VA, there is a lot more of that.
Right.
Because they're veterans, there's a thing called service connection, which is if you have a medical or mental health condition related to or given to you during your time in service, whether or not it was related to your job. So it's not like work comp, because work comp is like you get hurt on the job, doing the job, then they give you benefits for that. This is just, let's say I went into the Army, and while I was in the Army, I was out with my friends and I got into a car accident on the way back. I would then be service connected when I got out of the military for that. I could be, right? Same thing with things like depression, anxiety. I actually saw for the very first time somebody come through with a service-connected diagnosis of neurosis, which is not even in the DSM anymore. I mean, it's just like this super vague, like...
He was weird, right? Or he's had issues.
I was like, okay, yeah, like, okay. So it could be that, the VA is probably expensive. I mean, if you compared it to community mental health.
Right.
So I don't have much of a opinion about that. I think what I do know is from working in community mental health versus the VA, there's a staggering difference in resources. We get evidence-based training on a regular basis. We can get, all the kind of manuals and books and any kind of anything to assist us in doing our jobs. I mean, they even have surveys that they put out that ask the providers about that specifically to see if there's things that they need or think they need to better serve veterans. And, usually, it kind of ebbs and flows like any kind of funding thing does. I mean, there's times when I've literally at the end of the year been told, you have $20,000 that you need to spend by Friday or something like that. And then I'm going crazy, like trying to find things to buy. But then there's times whenever, there's no money in the pot too, and I want to send somebody to a training and I can't. But overall, there's no comparison to community mental health. And it's kind of sad because, clinicians in the VA are better. And the reason they're better is because they have more resources for training. And, we both worked in community mental health. What evidence-based trainings did you ever participate in? Right, exactly. Me too, Luckily, I had a super awesome team that I did my clinical supervision with. So I think I think because of that, I was above the curve. When I was at Fellowship House is what I'm talking about. And
Are you an LCSW?
Yeah, I have been for 10 years. Yeah, and so let me just start from I work in behavioral medicine in the VA, which is, there's the hospital, and then, have you ever been there? No. Well, there's like the main hospital, and then they have little other buildings, and one of the buildings is called the Center for Behavioral Health, and then another building is called the AMVETS building, and that's not us, but the Center for Behavioral Health was just opened a couple years ago, and then the building that I work in, or that my office is in, is the residential treatment program. Because right now my position is I'm a program manager, or DOM chief is what they call it in the military or the VA. And I run, right now it's 14 beds. We have expanded to 20, but we haven't opened those other 6 beds yet, residential treatment program for veterans. And we have tracks in that. One of them is PTSD, one of them is serious mental illness, and the other one is substance use disorders. I also manage the addictions treatment program and the PTSD clinical team. Those are both outpatient specialty programs that see veterans only for those specific issues. And it has to be combat PTSD for our PCT team. So if they have other trauma, like a lot of times, you're going to see childhood sexual trauma, and that, or any other kind of trauma that wasn't, or, I remember a guy that we had once that had been in a gang, or it was like a mafia type thing, and he had really severe trauma from his experiences there, but he was also a veteran, and he couldn't be seen. He would have to be seen by somebody in outpatient mental health, which we didn't think was intensive enough for him, so he came to the residential program. So I have those 3, and those are all specialty programs within behavioral medicine. So when you look at like stepped care, am I talking out of, I don't know what.
Okay, that's fine. So just make sure I understand. You're above residential treatment, which is in the behavioral medicine department.
Yes.
You have 14 beds. So basically it's like a hospital.
20. Yeah.
It is like a hospital.
It is, but it's not inpatient in the sense that, like, we have, I think right now, 11 nurses. I mean, it's a 24/7 program, but if somebody has any kind of significant medical condition, they can't be in there because we don't have the nursing staff.
That's the same way with a lot of places. It is significant. Okay, but it is like, so it's like a mental hospital. It's similar to like Schott or.
Yeah, except Schott has people, their focus is really serious mental illness. Ours is PTSD and substance use disorders. Okay. In fact, the lowest number of referrals we get are for people with serious mental illness. And even when we do, like sometimes and rarely we get somebody with schizophrenia or bipolar disorder. Okay. Those conditions, primarily your primary intervention for those is medication. Whereas what we do is intensive therapy. And sometimes people need both, but a lot of times, people with schizophrenia they're not going to benefit as much from that as somebody with, say, major depressive disorder, where you have cognitive behavioral therapy, or somebody with PTSD and you use cognitive processing therapy with them, and it's an evidence-based intervention that has this many, it's real structured.
Okay. So different from that is the outpatient.
Yes.
Which is where they just show up once a week, twice a week, and they see a counselor for an hour and they leave. That is not part of it's not part of your department.
Well, I have the addiction treatment program and the PCT are both outpatient programs.
Well, they are?
Yes.
Okay, so the residential treatment with the 14 beds, that's just for who?
Well, I'll explain stepped care, and that'll help explain this more. So let's just take, Joe veteran. He shows up and he comes in and he says, he's having some problem and he wants to see somebody, He hasn't been registered. The first thing that has to happen is he would have to go and get registered at the VA, at the Marion VA main hospital. And then once he did that, they would assign him a primary care physician. And then the way that it used to work was he would have his first appointment with that primary care physician. If it was like a crisis, he could go to the ER and we would handle it from there. But let's just say he's just saying, I want to see somebody about something. And then they put in a consult, which is basically something to alert us to the fact that this veteran wants services. And then we have so long now, it's 2 days, for someone to contact him to try to get him scheduled in for an appointment within 30 days. And then what would happen is they would come in to behavioral medicine, and we have like a group where it's just like a general, for people who are new to it, And then they meet with different people. We have our suicide prevention people there. We have prescribers or, like mid-levels, like nurse practitioners or a psychiatrist. They would see if they were interested in medication. And then they would get they would get triaged from there, Like we would figure out what was the biggest presenting concern for that person and what do they want. And then we would decide out of all of the programs that we have, where should we send this person? Where should we set them up? So there's just so much with this. I mean, I'm just going to go through all the programs within behavioral medicine. So you have outpatient mental health, which is just general, like if somebody says they have depression or anxiety, or they're worried about something, just kind of base level kind of stuff. And then we have a homeless program, which within that homeless program, we have something called a HUD-VASH. And that is something where, and this is one of the benefits I was talking about earlier, there are vouchers that veterans can get, which help. It's kind of like HUD, where they can get help and they only have to pay, I think, 30% or something like that of the rent, but they have to be able to have a certain amount of income. So the homeless program has 3 parts. It has the HUD-VASH, it has homeless, which is like if somebody needs shelter right now, and then we have something called, rapid employment for people who are homeless that want employment. So there's like kind of 3 things involved there. And then we have our suicide prevention program, which is, there's one of their brochures up there. And then we have the PTSD clinical team, the addictions treatment program. We have something called CWT, which is compensated work therapy, that has 2 parts to it. One is SE, which is supported employment, and that's for veterans with a serious mental illness. And that is like RAVE, or this is where we have case managers who help those people find jobs that would be appropriate to, their condition, and they help them with it. They case manage them all the way through their employment. And then the other one is compensated work therapy, which is for people who want to work like in the VA or in the community, and their skill set is maybe a little bit higher. And I have a lot of veterans that we send through that program and get jobs. And what's the best thing about being there is that I come in every day and I see veterans that have gone through my program and have graduated and have gotten employment, and now I just had one come in and see me the other day who is now like a supervisor in the place, and he graduated from our program like 5 years ago probably, and he still comes in and sees us and stuff, but he's gone from being in jail, that makes me think of our other program, in jail to and for methamphetamine related charges to and being a felon. So he got out of there. He didn't get, he has a felony. He was on probation, came to our program, graduated from our program, got into the CWT program, went out into the community to a place called Ison that's in Marion, and got let go from that job because he had such an attitude. Then he continued with outpatient, though, that supportive aftercare, and then worked with them, got into CWT, got a job, worked his way up, and is now a supervisor there and is successful. But, recovery isn't linear. It's not a straight line from here to there. It's like 2 steps forward, 3 steps back, over here. And so that's been the experience that he's had, but he still stays connected, which is the most important thing. So the way that we got him was through another program that we have in behavioral medicine called Veteran Justice Outreach, which is a program that works with courts within our catchment area to help veterans who are experiencing legal problems, oftentimes related to their substance use disorder or their PTSD sometimes, or all of those things together. Because a lot of times, PTSD and substance use disorders are comorbid conditions. They're dealing with both of them. And then they get into trouble. We get a lot of that referrals from them. We have people in Evansville is our biggest CBOC or community-based outpatient clinic. It's almost its own hospital. And we have those programs located there as well. So we have a VJO coordinator. So the way I think about it, for people who wanted to go into social work, the VA offers just like whatever interest you have, you could find something that would fit it. I mean, and even not on our side. So in the hospital, they also have a social work service. They can be clinical social workers, but their daily functioning is not to be a therapist or a clinical. They're more case managers, discharge planning for people from the hospital, or somebody. They also run the OEF program, which is for veterans in that Operation Enduring Freedom or Iraqi Freedom, and then they have a program that works specifically with them because they're seen as like a higher risk population. They also have a program that's specifically to work with veterans that are experiencing vision or blindness, vision problems or blindness. I mean, there's just so many things that you could do. There's a caregiver program for veterans that need care in the home. There's home-based primary care where the social worker goes to their home and sees them and works with them there. I mean, I could just go on and on that how many opportunities there are for different kind of things to do in the VA.
It's surprising because Marion area, it seems like it's fairly rural. I mean, I know Marion.
It is rural.
Carbondale, but do you pull from
Yes.
all over the place?
I mean, we have a 3-state catchment area, and we still, and even with that, we get people from. I get tons of referrals from St. Louis. I get referrals from Tennessee. I mean, we can get referrals to our residential program from all over the country. But as far as who is served by the Marion VA, it's Indiana, Kentucky, Illinois. Now, sometimes, because a veteran can do that, he could live in Tennessee and say, I'd rather go to Marion, and we have a couple that do that. I've had people come from Cape because they...
Is there a veteran place in Cape Girardeau?
There's a CBOC there. So St. Louis is their main facility, and so there's a community-based outpatient clinic there, which generally those aren't going to offer the same kind of services because they're small, you know. And then we have primary care social workers under social work service. They work with primary care doctors. Like, let's say the primary care doctors have somebody who comes in and they see them for some medical condition, and the veteran happens to mention, I'm having problems with my roof, and I don't have the money to pay for getting it fixed. They would refer them to the primary care social worker. Then behavioral medicine and primary care, we have something called primary care mental health integration. That is a team that works, it's kind of like a liaison relationship between primary care and mental health. So that was like a case management type thing, right? Trying to find where they could have funds to fix the roof. Let's say that veteran comes in and sees the primary care doctor, and the primary care doctor does what we call a clinical reminder for depression. And they ask like 5 questions. You know, are you experiencing A, B, or C? Are you? And that screen ends up being positive. Now we want to get a warm handoff. We want to make sure that we touch that veteran from mental health. And so we have those teams there so that they're like the liaison. So that primary care doctor says, hey, you know, Sonja, I have this veteran, you know, can you see them right now while they're here, and talk to them about what kind of services we have for that here. And then hopefully we get them, you know, set up to either come to a group or see a therapist. Make sense?
Yeah.
It's a lot.
I mean, it is state of the art. I know, like it really is compared to what we know.
Yeah.
You know, although I don't think that Delta Center was that bad. I
thought actually they did a lot of things well.
I do too. I really do. I mean, that PRRC program was good. And then they had outpatient therapists, you know, that are good. They're just, the difference is that we have a lot more resources, a lot more programs, and a lot more training.
Yeah.
That's what I told them. I said it's really about money, or a lot
It
of it
is.
with money, because you're able to recruit people to your agency away from community mental health.
Yeah, you know what else it is?
Twice the salary or something.
You know
like
what
that.
else? Yeah, I mean, I think I was a supervisor where him and I used to work together, and even though they said, oh, well, you get a 35-hour work week, I never worked 35 hours ever.
Right.
I worked a minimum of 40 hours a week and was getting, I think I made like 42 or 43,000 as a supervisor of 2 pretty major programs. And I don't remember how many staff, but like probably 10 people. Plus I carried the caseload of 42 people and did all the assessment and treatment planning for that. And then I go to the VA. All I have to do is be an outpatient addiction therapist And I think I started at 58.
Wow.
Wow.
I was a GS 11. I am now,
What is
with
a
that
GS?
promotion, a GS 14.
What is a GS?
What's,
It's a grade scale, so it's like a pay scale.
oh,
Or maybe it's government scale. I don't know exactly, but and they go from like a GS2 up to I think the highest one you can get. The highest one at our facility is a 15. I'm a 14, and the director's a 15, I think,
Wow.
or maybe. Now I think there's some doctors, some way high up, like in the military, where you can be a 17, like some general or
Yeah.
something like that. And so you go. I was a 13 as a supervisor. And the way the VA works is you have to be in a position in that grade level before you can apply to the next one. So in other words, only people with the experience of these different levels can be, so in other words, like if somebody was a straight therapist and that associate chief position that I applied for came open, they can't apply for it, and they shouldn't, because they don't have the experience needed to do that job. I do, because I've been a GS 13 for 8 years or 7 years or something like that.
Okay. Can you describe what your daily activities are?
Mine?
Yeah.
I should describe them. So when I was a therapist, because that's what these guys would be mostly going into, right?
Right, but it's also understanding the agency itself. You know, so either way, if you want to describe what you do as a therapist.
There's so many, because like when I listed all those different programs,
Yeah.